Thanks for coming. I'm Tim Cartwright, the Family Violence Reform Implementation Monitor. I acknowledge to start the traditional owners of the land, the first Australians and the people of the Kulin Nations and their elders past and present. I also want to acknowledge largely the women who've come before us over the last 20 or 30 years advocating on family violence and have got us to this point. I stand on strong shoulders and we build on their advocacy. I'll begin as I want to finish, and that is to remind us that this is about victims and survivors. Everything we do in this reform, everything I do, is about making the best of the opportunities we have to make this a safer place for them. 3 years ago, the Royal Commission into Family Violence handed down its historic report and set the basis for the state government's reform package. I can't overstate the complexity and significance of the reform, the ambition and the challenges it faces. It's an enormous task. My role as the Family Violence Reform Implementation Monitor is to hold the government to account for delivering the reform package that arose out of the Royal Commission. But I'm active in that work. I work alongside government and the sector, its agencies, and I work in real time to identify things that are happening and to make sure that we do and take the best possible chances to take the most of the opportunities we have. My office is tasked with identifying and sharing better practice, and when I see increased risks, I talk to the decision makers about that. Last year in my first annual report, I focused on what I called the foundational issues. There were things then that needed to be addressed. Today, in my second annual report to the Victorian Parliament, I look back on the monitoring period that ran from the 1st of November 2017 to the 1st of November 2018. Once again, I was guided by two fundamental questions. What's best for the current and future victim survivors, and what is it that will break the cycle and prevent people becoming victim survivors and perpetrators in the future? In the report, I focused on three key areas this year. They are the support and safety hubs, known as the Orange Door, the primary prevention, and most importantly, the voices of victim survivors. This morning I want to concentrate particularly on the hubs, a flagship element of the government's reform package. They're designed as a safe place for victim survivors of family violence to go and access the right help, to get it quickly and to minimise the effort that they have to take to get that help. 5 hubs were opened in 2018, and while I congratulate the government on those establishments, I believe significant risks remain around before we can be sure of their effectiveness. They are the biggest budget, the biggest change, the biggest profile, and unfortunately the biggest risk. The hubs are an incredible concept. They have the opportunity to be a game changer for victim survivors. That's why it's vital that they're done properly. However, the implementation of the first 5 hubs, I believe, was rushed. There was a lot of work to be done. There had to be planning, policies developed, new IT systems, information sharing regimes, establishing the physical facilities, recruiting well-equipped and trained staff. I think the initial planned timeframe was too short. The hubs were rushed. This doesn't mean that government should stop now as it rolls out the next 3 hubs in the tranche of the reforms. It simply means that it has the opportunity to reflect and learn and a better chance to get it right for the future. I want to emphasise too that I'm not criticising the people who work in those hubs or Family Safety Victoria. Like all the people in this reform, they are enormously committed and working so hard to get it right. But as a monitor, it's my role to hold the government to account. There are 2 other areas of the report which I've focused on, as I've said, primary prevention and capturing the voices of victim survivors. In those 2 areas, we've seen very strong foundations laid. The opportunity now is to build on those foundations again, to get it right, to maximise the impact, to maximise the opportunity we have to make victims and survivors safe. As a community, we've come a long way, but we've got a long way to go. This will take a generation or more. At the end, before I hand over the questions, I go back to where I started. The people at the heart of the reform are the victim survivors. They are what this is all about. We have to get this right. We owe it to them. We have to build a community where family violence is no longer tolerated, where it's a thing of the past. It's a long, tough road, but we have to follow it to the end. Thank you. I'll open up for questions.
When you say it's been rushed, is it financially rushed? They're taking on as many victims too soon already? What do you actually mean by
When you look at the enormity of the task and even establishing the hubs, they had to establish new physical facilities, new IT systems, new practices, recruit new people. There wasn't sufficient time allowed for that to make sure that we got it right. I'm not surprised that there are some that I'm criticising that. As I said at the outset, it's an enormously challenging task. What I'm urging government to do now is to learn from that and to get it right for the next hubs.
Does that have adverse impacts on victims seeking support?
I don't know. It's too early to tell, but what I do know is there is an opportunity to do it better, to learn from those. The statistics at this early stage, when you look, the hubs, some of them have only been established 3 or 4 months. The statistics are only just starting to come in, but it's something I'll very keenly watch.
How has that, I suppose, not optimised the treatment of victims so far and much?
Again, it's difficult to say. I think it's more about losing the opportunities that are presented. This really has the opportunity to be a game changer. It's not a game changer yet. One of the challenges for the hubs is all those problems were out in other areas. They've now all come into the hubs, so they're much more obvious than I think they were. Again, I say to the government, take your time, learn from those 5 hubs, get it right for the next 3.
Is there any indication that people were left waiting or couldn't get in or couldn't get the right services when they did?
Again, it's early days. I think the first hubs were established mid last year, so we're talking 6 to 9 months, and those hubs were established in temporary premises. I can't say conclusively. There will always be challenges in establishing something as different as the hubs. I'll watch with interest, I'll listen to the sector, I'll listen to the victim survivors. I should say also that Family Safety Victoria, who are responsible for the hubs, are aware of these challenges and are working hard to address them.
Is it those people that work in the hubs or the victims themselves that have given you the information for you to say that they have been rushed?
No, it's me drawing the conclusions. So I'll talk to the victim survivors, I'll talk to the representatives, I'll talk to the people who had experience in those areas. I also talk to the workers, I talk to the peak bodies, the advocacy groups. I try and spread my information gathering as far as I can, and from that I've concluded we should have taken more time. There was an opportunity to take more time, take it now.
Can we have more time and the crime rate's gone up by 5.7%?
Yep. This is the challenge for government, is that balancing that need for urgency, that need to address things early, whereas we have the opportunity to get it right. That is a big challenge for them. I think we have to take the time, because to do otherwise risks us defeating the purpose of the hubs, of the victims coming in and not getting the experience they deserved, it not being as easy as possible, it not being as safe as possible, and enabling them to be safe. That's the challenge.
What's the response from the government then to your suggestion where you're finding that it's simply a running process?
So I've tabled today, so we haven't had a formal response. I've had discussions. As I said, Family Safety Victoria and the government are aware of my concerns. They're working hard to get it right. What I'm saying to them in the current report is take your time, get it right. I understand the urgency, but it's critical that we get it right for the victim survivor.
How much time should they take?
Good question. I don't know the answer. It's a piece of string. I suspect no matter how much time they took, there'll be learnings. The hubs have to evolve. When we put it in perspective, some of these things are certainly Australian leading, some of them are world leading. There is, in a lot of areas, no evidence on which to base, nowhere we can go back and check on previous experience. I don't know how long it takes, but we have an opportunity now to slow down and learn from those first 5 hubs.
And from those that have been rushed, how much time now need to be continued to ensure that they are scratched?
Yes. Family Safety Victoria, the people working in those hubs, the support services around are working very hard to address the issues that are being identified as they emerge. I don't know if we'll ever get it 100% right, because as we progress, we'll learn. And as we learn in one area, we'll transfer that knowledge to other areas. When you look at professional development, there is so much more that people in the field can learn. There is no base on which to learn. It will take time, and we know it'll take 8 to 10 years before we start to see it turn around.
So you talked before about information sharing, obviously that's one of the big challenges in this area. In terms of how that's working in the hubs, have they had to create sort of specific IT systems to put all that information into? Are you satisfied that that's effectively on yet?
One of the recommendations was to create those IT systems. They're bringing together a lot of existing systems from police, from courts, from DHHS. Those systems, I know from experience, had their own challenges. So this will take a lot of time and it's a big effort on its own. In the interim, there's been a workaround put in place which sees manual exchange of information. One of the things I get back from the workers is that is a great benefit to assessing the risk for victim survivors. It's a big challenge. It will take a long time to get the IT systems right, but already we're seeing benefits in that field.
So you talk in your report about not enough skilled workers. Is
Yeah.
that a case of not enough money either, or just not enough people who are actually trained to help
Yes.
work in this sector? I guess?
So this coming year, the year I'm in, I choose 3 other areas of focus. One of them was around workforce development, but when I've looked into it, it is right across the community sector. It's not just family violence, it's in primary health care, it's in community health care, it is right across the sector. There are more demands as we realise the extent of the challenge and what we need to do. There are more demands, and again, that expertise doesn't necessarily exist. So it's not just the workers who need to develop, it's the training systems, it's developing the trainers. This alone is an enormous challenge.
And do you think that, I guess it's a sector-wide issue, is that because not enough people are attracted to take up a career in the sector? Is the pay not good enough? Is the hours too grueling? Is there not enough support for workers? Do you identify that?
I wish I could, because then we'd be part way to the solution. There is a specific stream of work focused just on developing the workforce, and it'll take years again to get that right. There'll be a whole combination of factors, some of which you've mentioned. I think part of it also is we just haven't realised the unmet demand until now. Not at all. So when we quote, for example, the Victoria Police stats of 79,000 incidents, those stats have been rising consistently at around 10% for the last 10 years. We got to 80,000, they've plateaued over the last couple of years. I think that's just the tip of the iceberg. I think for every 79,000 there'd probably be another, who knows, 3 or 4-fold that number. We know that people don't go to the police the first time it occurs. We know that there are so many communities that have additional barriers. That really is the tip of the iceberg. I'm not at all surprised. I take it as a positive indicator for us.
So it's not more family violence, it's securing the fact that people speak out about it. Is that?
I would hope that's what it is. I can't do the analysis, but it is what we expected. We expected as we get better at addressing family violence, we get better at protecting victim survivors, they'll be more confident coming forward. One of the challenges I've set for government is planning and articulating those sorts of things. What is it that we expect to see in year 2, year 3, year 4? So the community understands when the crime stats go up, it's what we anticipated and it may well be a good thing.
So will you be expecting further rises in this area?
Yes, and I would take that as a positive thing. If more people are prepared to come forward to the hubs, more people are prepared to come forward to police, then they are more confident in the system. The challenge has been to give them that confidence so that they encourage others. And we do build, at least in the short term, 7 or 8 years before we see a plateauing is what we expect.
I appreciate you said it was too early to say what the outcome of the Russian safety hubs is, but is it possible that maybe lives at risk as a result?
We come back to this is about people at risk. This is about individuals at risk. If they're going into the hubs, they are already at risk. This is the opportunity to do better for them. This is the opportunity for a game changer to get it right. I'm urging government to take that opportunity so that we look back in 20 years and say this absolutely was a seminal moment in terms of dealing with family violence.